So today we will discuss the ankle joints and joints of the foot. Okay. So ankle joint or talocrural joint, it is a strong weight bearing joint placed between the lower ends of tibia and fibula at the talus. Okay. Tibia and fibula articulating with the talus to form the ankle joint. What is the type of joint? It is a hinge variety of uniaxial synovial joint. Articular surfaces, ankle joint is compound articulation between the distal end of the tibia and fibula and superior surface of the talus. Okay. So, this is proximal articular surface, tibia and fibula, and distal articular surface is talus. So, here proximal articular surface has been shown. This is lateral malleolus articular surface of fibula, and this is inferior articular surface and medial malleolar articular surface of the tibia. This together forming a mortise or socket like structure in which talus is articulating. So, the proximal or superior articular surface is formed by a socket or ankle mortise. Ankle mortise is also called tibiofibular mortise, and the ankle mortise is formed by these following structures: lower end of tibia, medial malleolus, lateral malleolus, inferior transverse tibiofibular ligament. This is connecting tibia and fibula, lower end. And distal articular surface, distal or inferior articular surface is formed by articular parts of superior, medial and lateral surfaces of the talus. Superior pulley-shaped articular surface of talus. So, see here, this is the articular surface of talus. It is pulley-like. There is a depression in the middle and two elevations on the two sides. And here is the articulation, tibia and fibula together forming the mortise or socket-like structure where the talus is articulating. Okay. So, that is how ankle joint is forming here. So, superior pulley-shaped articular surface of talus articulates with inferior surface of lower end of the tibia and lateral malleolus of fibula. Comma-shaped articular facet on the medial surface of talus articulates with the lateral aspect of medial malleolus. Here, on the medial side, there is a comma-shaped articular surface. It articulates with medial malleolus of the medial malleolus of tibia, and triangular articular facet on the lateral surface of talus articulates with medial aspect of lateral malleolus. Here you can see this triangular articular facet for the medial aspect of lateral malleolus of fibula. Okay, so that's how you determine lateral and medial in case of talus. Okay, now we will discuss. So, this is trochlear surface, this is facet for lateral malleolus, here is facet for medial malleolus, that is comma-shaped. What is stability of the ankle joint? The superior articular surface of body of talus is wider anteriorly, you can see here, wider anteriorly and narrow posteriorly, and during dorsiflexion the ankle joint is stable as the anterior wider part of trochlea moves posteriorly and fits properly in the tibiofibular mortise and gives stability to the joint. Okay, stability is important for your movement because weight transmission is also occurring through this joint. In plantar flexion, the narrow posterior part moves forward and it does not fit properly in the tibiofibular mortise, that makes the ankle joint unstable. So, in plantar flexion the joint is unstable, but in dorsiflexion the joint is stable. Okay. So, what are the factors maintaining the stability of the ankle joint? The following factors make the joint stable: reciprocal shape and close interlocking of the articular surfaces, strong medial and lateral collateral ligaments, strong inferior transverse tibiofibular ligament, and tendons that cross the joint deep to the flexure and extensor retinacula and downward projecting medial and lateral malleoli. All these factors maintain the stability of the ankle joint. Okay, understood? আগেরটা ঠিক আছে, you see here, this is the trochlear surface, facet for lateral malleolus, facet for medial malleolus. Okay, head of the talus, neck of the talus. Here fracture occurs near the neck of the talus. Okay, and this is the superior articular surface, tibiofibular mortis, inferior surface of tibia. This is part of medial malleolus, this is part of lateral malleolus. Okay, next next we will discuss the ligaments. Okay, in foot there are some important ligaments. Ligaments are asked in your viva, or also if it is comes in theory question, you will be asked about ligaments. Okay, so this deltoid ligament can be given as a short note, important ligament. So the ankle joint is supported by the following ligaments: fibrous capsule, deltoid ligament, lateral collateral ligament, and inferior transverse tibiofibular ligament. So first we will discuss the fibrous capsule. It surrounds the joint cavity completely and it is weak on the anterior and posterior aspects. What is the attachment? The capsule is attached to the margins of articular surfaces of the medial malleolus, tibia, lateral malleolus and talus. And the synovial membrane lines the inner aspect of the capsule. A part of synovial membrane projects upward into the distal tibiofibular joint. So this is attachment of fibrous capsule. Next, it surrounds the, we have discussed like this. Next we discuss the deltoid ligament or medial collateral ligament. See here, this triangular ligament, this is known as the deltoid ligament. The deltoid ligament is a strong triangular band and that reinforces the medial aspect of the ankle joint, and this ligament has superficial and deep parts. So what are the attachments? Proximal attachment. Both the parts are attached superiorly to the apex and margins of the medial malleoli. See, this is the medial malleolus. So the ligament is attached superiorly to the apex and margins of medial malleoli. And distal attachment, superficial part is divided into three compartments based on the distal or inferior attachments as follows. Anterior tibio-navicular ligament. See here, this is tibio-navicular ligament connecting the tibia with this navicular bone. Yesterday you have learned the bones, tarsal bone. So this is navicular, and anteriorly, tibio-navicular ligament is attached to the tuberosity of the navicular bone and the medial margin of spring ligament. Spring ligament is below here. This is spring ligament. Then middle tibio-calcaneal ligament. Okay. See here, this is the tibio-calcaneal fibers attached to sustentaculum tali. Middle tibio-calcaneal ligament is attached to the tubercle on the lateral surface of the calcaneum, and posterior tibiotalar ligament is attached to the medial tubercle and adjoining part of the medial surface of the talus. And deep parts form the anterior tibiotalar ligament that is attached to the anterior part of medial surface of the talus. Okay. You just remember it has a superficial part and deep part, and if possible you can remember these two fibers. These are important, tibio-navicular and tibio-calcaneal. Okay. Next we go to lateral collateral ligament. So deltoid ligament is supporting the joint from the medial aspect, connecting the tibial malleolus or medial malleolus with the navicular, calcaneum and talus. Okay. So lateral collateral ligament is a strong compound ligament that reinforces the lateral aspect of ankle joint. Consists of three parts: anterior talofibular, here is anterior talofibular, posterior talofibular and calcaneofibular. These three are together forming the lateral collateral ligament. Okay, understood? Next we go to the inferior transverse tibiofibular ligament. It is a strong thick band that extends transversely from the upper part of the malleolar fossa of the fibula to the posterior border of articular surface of the tibia. Okay, connecting, that means connecting the lower ends of the tibia and fibula, forming the inferior tibiofibular joint. Inferior tibiofibular joint is not synovial, it is fibrous type of joint, okay, formed by this ligament, inferior transverse tibiofibular ligament. Next, okay, so the joint capsule of ankle joint is attached to the margins of articular surfaces except at these following points. Posterior superiorly, capsule is attached to the inferior transverse tibiofibular ligament, and anterior inferiorly, the capsule extends on the neck of the talus for some distance. Anterior talofibular ligament, it is a weak band and that extends anteriorly from the anterior margin of lateral malleolus to the neck of the talus. Posterior talofibular ligament, it is a strong band that extends posteriorly from the lower part of the malleolar fossa of the fibula to the lateral tubercle of the talus. And calcaneofibular ligament, it is a long rounded cord that extends from apex of the lateral malleolus to the tubercle on the lateral aspect of the calcaneum. So this is the attachment of different ligaments. Next, next we go to relations of the ankle joint. First, anterior relation. See, this is a cross section through the ankle joint. Mid portion there is talus, medially tibia, tibial malleolus actually, and this is fibula or lateral malleolus. So these structures are lying anteriorly, these are laterally, and this is anterior structures, this is posterolateral, and these structures are lying posteriorly. Okay, so ankle joint anterior structures, you have seen the anterolateral compartment muscles, nerves and vessels, they are crossing in front of this anterior aspect of the ankle joint. So these are same structures. So ankle joint is related anteriorly from medial to lateral to the following structures. Okay, first is tibialis anterior. This is from tibialis anterior. Next is extensor hallucis longus. Here is the hallucis longus. Then there is anterior tibial artery and deep peroneal nerve. Anterior tibial artery, deep peroneal nerve, extensor digitorum longus. Here is the digitorum longus and this is peroneus tertius. Actually this marking is wrong. This will be tibia, this will be fibula. Okay. Tibia lying medially. So here we are seeing the structures from medial to lateral. Okay. Next is we go to the posterior relations. Ankle joint is related posteriorly from medial to lateral. These following structures. Tibialis posterior, here tibialis posterior. Next is flexor digitorum longus. Then posterior tibial artery, tibial nerve, and flexor hallucis longus. So you can remember like this mnemonic. Next we go to posterolateral relation. There is peroneus longus, this is superficially present, and deeply present is peroneus brevis. So ankle joint is crossed posterolaterally by the tendons of peroneus longus and peroneus brevis. Okay, understood? Okay, next we go to blood supply and innervation, nerve supply. Blood supply, the ankle joint is supplied by malleolar branches of anterior tibial, posterior tibial and peroneal arteries. You have seen in relation to the ankle joint anterior and posterior tibial arteries, and also there is peroneal arteries. So nerve supply is supplied by branches of deep peroneal and tibial nerves. Okay, what is the movements? The following two main movements occur in the ankle joint: dorsiflexion, plantiflexion. See this position, red colored one, this is dorsiflexion. It is done by tibialis anterior, extensor digitorum longus, extensor hallucis longus, and this dorsiflexion is done by this root value L5S1, and this is plantarflexion. In dorsiflex position, ankle joint is most stable, and in plantarflexed it is most unstable. Plantar flexion is done by gastrocnemius. This posterior compartment muscle will do the plantar flexion. Gastrocnemius, plantaris, tibialis posterior, flexor hallucis longus and flexor digitorum longus. And this is the root value for plantarflexion S1 and S2. Okay. So dorsiflexion, in dorsiflexion the forefoot is raised and the angle between the front of leg and dorsum of the foot is decreased. Here the angle is decreased and this is normal position at 90 degree. In plantar flexion, the forefoot is depressed and the angle between the front of the leg and dorsum of the foot is increased. This angle is increasing. Okay. Next. So, this is the two movements, dorsiflexion and plantarflexion. What occurs? Forefoot is raised in dorsiflexion, forefoot is depressed in plantarflexion. And you can write down like this: main muscles or principal muscles involved and accessory muscles. So, for dorsiflexion, main muscle is tibialis anterior. For plantarflexion, main muscle is gastrocnemius. Okay, that gastrocnemius soleus tendons together forming the tendocalcaneus, which is attached over the calcaneum. That is the main tendon for plantarflexion. Okay, another muscle accessory muscles for dorsiflexion are the extensor digitorum longus, extensor hallucis longus, and for plantarflexion there is plantaris, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Okay, understood. Next. So dorsiflex position is a closed packed position of the ankle joint, and in dorsiflexion there is maximum congruence of articular surfaces and tension in the ligaments, and that stabilizes the joint and prevents dislocation. So this is stable condition, dorsiflex position. And plantar flex position, it is a loose packed position of the ankle joint, and in plantar flexion the narrow posterior part of trochlear surface of talus loosely fits into the tibiofibular mortise, and that makes the joint unstable and prone for dislocation. The range of movement of dorsiflexion of ankle joint is 20 degree and the plantar flexion it is 45 degree. Okay, understood? If when you do this in your own leg, you can feel it. Dorsiflexion, not much dorsiflexion is possible. Only 20 degree, and plantarflexion it can be done up to 45 degree. Next. Next we go to clinical aspect of the ankle joint. First one is ankle sprain. An ankle sprain is partial or complete tear in the ligaments due to excessive inversion of the plantar flexed foot. Here, this is plantar flexed foot, excessive inversion. Torn anterior tibiofibular part or lateral collateral ligament. Okay, due to excessive inversion of plantar flexed foot, and the lateral collateral ligament commonly gets sprained due to its weakness than the medial collateral ligament. Okay, so these were parts of talofibular part of lateral collateral ligament which is torn due to its weakness than the medial collateral ligament, and as it resists the inversion. Anterior talofibular part of lateral ligament is affected most commonly. Now go to dislocation of ankle. Dislocation of ankle joint occurs mostly in the plantar flexion as the joint becomes unstable in this position, and it is usually associated with malleolar fractures. Okay, if medial malleolar fracture, there is risk of dislocation to the medial side, and if lateral malleolar fracture, there will be dislocation towards the lateral side. Next we go to Pott's fracture. It is a fracture dislocation of the ankle that involving features: oblique fracture of the lateral malleolus, transverse fracture of the medial malleolus, anterior dislocation of the tibia over the talus, and sometimes fracture of the posterior margin of lower end of tibia called the third malleolus may also occur. Okay, so these are the components of Pott's fracture. This is sometimes comes as a part of long question. Okay, Pott's fracture. What is Pott's fracture? Like this. Next is optimum position of the ankle joint. During application of plaster cast in the ankle region, ankle joint should be maintained in optimum position. That is slightly plantar flexed ankle joint. Okay. So this is in optimum position. You have to do the plaster. You have to do it in your intensive plaster cast. Okay. Next we go to ankle ring. Ankle joint with associated ligaments form a ankle ring. Ankle arthroplasty, it is replacement of ankle joint with prosthesis, and it may be formed in severe cases of ankle arthrodesis. That means fusion of the bones forming the ankle joint and in different injuries. Okay. So these are the clinical aspects. Next, here Pott's fracture, different components. See, oblique fracture of lateral malleolus, transverse fracture of medial malleolus, and anterior dislocation of tibia over the talus. Okay, these are the main components of Pott's fracture. Next, we go to tibiofibular joints. Three tibiofibular joints are there: superior, middle and inferior. Like in your superior extremity, there were joints between the radius and ulna. Okay. So tibiofibular articulation occurs at three joints: superior tibiofibular joint, middle tibiofibular joint and inferior tibiofibular joint. See here, superior tibiofibular joint is plain synovial joint. Middle tibiofibular joint is fibrous joint formed by the interosseous membrane, and inferior tibiofibular joint is syndesmosis formed by the inferior tibiofibular ligament, which we have discussed during the ankle joint. So tibiofibular articulation occurs at three joints: superior, middle and inferior tibiofibular joints. Superior tibiofibular joint, it is a plain type of synovial joint, and it is formed by articulation between the head of fibula and lateral condyle of tibia. Here, head of fibula, lateral condyle of tibia. Movements, only a small range of gliding or rotatory movements are permitted to adjust the lateral malleolus during movement of the ankle. And middle tibiofibular joint, it is a fibrous joint. Here you can see interosseous membrane formed by interosseous membrane connecting the interosseous borders of tibia and fibula. What are the direction of fibers? Fibers are directed downward and laterally towards the fibula. Okay. Passage at the upper end, there is an opening in the interosseous membrane and gives passage to the anterior tibial vessels, and small opening at the lower end gives passage to perforating branch of peroneal artery. See, this is the upper opening, this is the lower opening. What is the function of interosseous membrane? It provides attachment to the muscles, binds firmly tibia fibula together and resists the downward pull of fibula by the peroneal muscles. Next, inferior tibiofibular joint, it is a syndesmosis and that connects the lower ends of the tibia and fibula here by a very strong interosseous ligament. There are two interosseous tibiofibular ligament, anterior tibiofibular ligament, posterior tibiofibular ligament. Posterior tibiofibular ligaments, it is stronger than the anterior, and the lower and deep position of posterior tibiofibular ligaments form a strong, thick, yellowish elastic band called the inferior transverse tibiofibular ligament. An inferior tibiofibular joint permits slight lateral rotation of the lateral malleolus during the dislocation at the ankle joint. Innervation, superior tibiofibular joint, it is supplied by nerve to popliteus and recurrent genicular nerve. Middle tibiofibular joint by nerve to popliteus, and inferior tibiofibular joint by deep peroneal, tibial and saphenous nerves. Okay, so this is nerve supply of these three joints. Next we go to the joints of the foot. Okay, these are the joints are grouped in this following groups. Intertarsal joints, that means joints formed between the tarsal bones. Next is tarso-metatarsal joint, between tarsal bones and metatarsal bones. Metatarsophalangeal joint formed between metatarsal and phalanges. Interphalangeal joint formed between the phalanges, proximal, medial and distal phalanges. So these are the joints present in our foot. Next, see here, this is subtalar joint. This is talonavicular joint. This is calcaneocuboid joint. This is cuneonavicular joint. These are the intercuneiform joints, and this is cuneocuboid joints. All these joints are formed between the tarsal bones. So all these are included in intertarsal joints. Then this red colored one, this is tarso-metatarsal joint formed between the tarsal bones and metatarsal bones. And these are intermetatarsal joint formed between the metatarsals. Next, between the head of the metatarsal and base of the phalanges, here lies the metatarsophalangeal joint. And here near the tip of the, here this in between the phalanges, here lies the interphalangeal joint of grade 2. Here is proximal and distal interphalangeal joints for the other two. Understood? Next. So intertarsal joint, subtalar joint is important because inversion and eversion of foot occurs in this subtalar joint. Okay, that's why inversion eversion comes in your theory question, very important theory question, inversion eversion of foot. So intertarsal joints are the joints of the tarsal bones, include these following joints: subtalar joint, talocalcaneo-navicular joint, here this is talocalcaneo-navicular joint, calcaneo-cuboid joint, calcaneo-navicular, intercuneiform, you have seen in the previous picture. Next, subtalar joint we will discuss in details. Subtalar joint, see here, this is talocalcaneal joint. Subtalar joint is mainly talocalcaneo-navicular joint is called subtalar joint. So it is articulation of talus with the calcaneum. It has two articular components: anterior talocalcaneal articulation. It involves the articulation of a convex area of the talus that feeds on a concave facet on the superior surface of calcaneum. Here, okay, here is anterior talocalcaneal articulation. Next is posterior talocalcaneal. This is posterior part, and here is the anterior part, this convex part. This posterior talocalcaneal articulation, it involves articulation of concave surface of talus and convex surface of the calcaneum, and fibrous capsule, lateral medial talocalcaneal ligaments, interosseous ligament, cervical ligament supports this subtalar joint. This talocalcaneal joint is plain synovial joint. Type of joint is asked in your viva. Okay, subtalar joint, what type of joint? Plain synovial joint. And movement, it permits the inversion and eversion of the foot. Okay, so it is mainly occurring between talus and calcaneum, talocalcaneal joint. Next we go to calcaneocuboid joint. Here calcaneum and cuboid, in between these two calcaneocuboid. It is a saddle type of synovial joint. Previous one was plain type of synovial. Here it is saddle type of synovial joint, and it is an articulation between the calcaneum and cuboid, supported by fibrous capsule, calcaneocuboid ligament, biforate ligament and long plantar ligaments. Next is talocalcaneo-navicular joint. This is very frequently asked. What is the type of joint? It is a ball and socket variety of synovial joint. Very, very important, talocalcaneo-navicular joint. It is a compound joint as three bones, talus, calcaneum and navicular, form this joint. Head of the talus feeds into the socket formed by the calcaneum navicular and spring ligament. See here, this is head of the talus articulates with the socket formed by the navicular spring ligament and the calcaneus. So this joint, whole of the joint together is forming the talocalcaneo-navicular joint, and this one component formed between the talus and calcaneum is only known as the subtalar joint. So it is the subtalar joint is part of this talocalcaneo-navicular joint. Head of the talus fits in the socket formed by the calcaneum, navicular and spring ligament. What is the movement? It permits the inversion and eversion movement. Next we go to transverse tarsal or mid-tarsal joint, Chopard's joint. It is a compound synovial joint, includes talonavicular, here is the talonavicular and calcaneocuboid. This is also known as mid-tarsal joint, most frequently known as this name, mid-tarsal joint, okay, or transverse tarsal, Chopard's joint, these names are also used. So, subtalar joint, mid-tarsal joint, talocalcaneo-navicular joints, all these are important. Formed between which bones you have to know, and type of joint. So, talocalcaneo-navicular was ball and socket type of joint. Ball is formed by the head of talus, socket is formed by three structures, spring ligament, calcaneum, navicular. Okay. So, and this is mid-tarsal joint. They lie in the same plane, but functionally they have different axes of movement. It helps in eversion and inversion of the foot. Next is tarsometatarsal joint. These are 5 plain synovial joint supported by dorsal plantar and interosseous tarsometatarsal ligaments. They permit limited gliding movements. Metatarsophalangeal joints, they are 5 ellipsoid joints supported by capsular, collateral, plantar and deep transverse metatarsal ligaments. They permit this following movement: plantar flexion 30 to 40 degree and dorsiflexion 50 to 60 degree. Adduction and abduction, the axis of adduction and abduction pass through the second metatarsal bone. Next we go to the interphalangeal joint. These are 9 hinge variety of synovial joint. They permit dorsiflexion, plantar flexion of distal phalanges. This joint you just know the name and type of joint. Okay, this is plain synovial, tarsometatarsal, metatarsophalangeal is ellipsoid and interphalangeal is hinge. Type of joint is important here. Next, ligaments of the foot. Okay, important ligaments we will discuss. Foot is supported by a number of ligaments. Some of the major ligaments are dorsal talonavicular ligament. It extends from neck of the talus to the dorsal surface of navicular bone. Spring ligament. It is also known as plantar calcaneo-navicular ligament, connecting the calcaneum and navicular. Spring ligament is asked very frequently. Bifurcated or internal calcaneocuboid ligament is biseparate ligament that extends from sulcus calcaneae to dorsal surface of navicular and cuboid bone. Next is dorsal calcaneocuboid, superior calcaneocuboid ligament extends from lateral surface of calcaneum to the cuboid. Okay. Next is long plantar ligament, also known as long calcaneocuboid ligament, and it extends from plantar surface of calcaneum to the groove on the cuboid and bases of middle 3 metatarsals. Next is short plantar ligament. This long plantar and short plantar is also important ligament. Okay, long plantar is long calcaneocuboid, short plantar is calcaneocuboid. Short plantar ligament lies deep to the long plantar ligament, extends from anterior tubercle of calcaneum to the plantar surface of cuboid behind the ridge. Plantar calcaneo-navicular ligament extends from plantar surface of the navicular to the plantar surface of 3 cuneiforms. Next we go to dorsal cuneo-navicular ligament, connects the dorsal surface of navicular to the dorsal surface of 3 cuneiforms. Next plantar cuboideo-navicular connects, these are names are representing which bones are connected, okay, and plantar and dorsal, this is representing where it is located. Plantar means it will be located on the plantar surface, and dorsal means located on the dorsal surface. Okay. So long and short plantar ligaments, spring ligaments, deltoid ligament, these are important ligaments, okay, for foot. All these you just know the names. Plantar cuboideo-navicular ligament connect plantar surface of cuboid and navicular. Dorsal cuboideo-navicular ligament connects dorsal surface of cuboid and navicular. Transverse metatarsal ligament connects the heads of all the metatarsal bones. And anterior talocalcaneal ligament extends from the front and lateral surface of neck of talus to the sinus tarsi of the calcaneum. Next, another ligaments. Posterior talocalcaneal ligament extend from lateral tubercle of talus to upper and medial part of calcaneum. Lateral talocalcaneal extends from lateral surface of talus to surface of lateral surface of calcaneum. Medial talocalcaneal extends from medial tubercle of talus to sustentaculum talus. Next, see the ligaments. Interosseous talocalcaneal ligament. This is plantar calcaneo-navicular ligament connecting calcaneum and navicular. This is long plantar ligament, and deep to it will be the short plantar ligament. Next, here you can see spring ligament connecting the plantar calcaneo-navicular ligament. Okay, connecting the calcaneum with the navicular sustentaculum. So this is spring ligament. Spring ligament is important. This is long plantar ligament connecting the calcaneum with the root of the metatarsals, base of the metatarsals, and one tunnel is formed, tunnel for peroneus longus. Next, this short plantar ligament. We have removed the long plantar ligaments here. Short plantar ligament is connecting the calcaneum with the cuboid. Okay, and this is group for peroneus longus. Next, here you can see the bifurcate ligament, okay, Y-shaped, and this is dorsal talonavicular ligament. Talus and navicular is connected. Next. So spring ligament is important. Spring ligament, this is spring ligament. It is also known as plantar calcaneo-navicular ligament. It is a thick white band of ligament and it is attached posterior to the anterior margin of sustentaculum tali and anteriorly to the plantar surface of the navicular bone. Sustentacular tali is a self-like projection from the calcaneum, and the head of the talus rests on the upper surface of spring ligament and the articular part of ligament is covered by fibrocartilage. Here it was forming the ball and socket type of joint, talocalcaneo-navicular, and spring ligament is important for maintenance of medial longitudinal arch of foot and it completes the socket for talocalcaneo-navicular joint. Okay, next. Long plantar ligament is a long and strong ligament attached posteriorly to the plantar surface of calcaneum, anteriorly to the lips of groove on the cuboid bone and base of middle three metatarsals here. It converts the groove on the plantar surface of cuboid into a tunnel for tendon of peroneus longus. So morphologically, long plantar ligament represents the detached part of tendon of gastrocnemius, which was inserting here over the calcaneum, and long plantar ligament maintains the longitudinal arches of the foot. It was acting as a tie beam or intersegmental ties. Next, short plantar ligament, it is known as calcaneo-cuboid ligament. Here it is broad and strong, attached posteriorly to the anterior tubercle of calcaneum to the plantar surface of cuboid behind its ridge. It lies deep to the long plantar ligament, also maintains the longitudinal arches of the foot. Next, bifurcate ligament is calcaneo-cuboid ligament. Y-shaped stem of ligament attached to the anterolateral part of the sulcus calcanei. Medial limb is attached to the dorsomedial surface of cuboid and forms calcaneo-cuboid part, supports the calcaneo-cuboid joint part of metatarsal. And cervical ligament it extends upward and medially from the upper surface of calcaneum to the tubercle on the inferolateral aspect of neck of talus. Okay, and it supports the subtalar joint, becomes taut in inversion and limits the inversion. Cervical ligament is deeply placed. Next we go to inversion, eversion. This comes as a long question. Inversion and eversion of foot. These are rotational movement of foot. It is a movement in which the medial border of foot is elevated and sole faces medially in inversion. Here is the inversion. You can see medial border of foot is elevated and sole faces medially. It is done by tibialis anterior and tibialis posterior. Up to 30-degree inversion is possible. And eversion is done by peroneus longus, brevis and tertius. Up to 20-degree eversion is possible. Here lateral elevated. Eversion is the movement in which lateral border of foot is elevated and sole faces laterally. Okay. This is the axis of movement act for inversion and eversion. It passes through, this is neck of talus, it passes through center of curvature of talocalcaneonavicular joint, center of curvature of subtalar joint, and axis of, this is the axis, so passes through these 2 points and ultimately passes through back of the calcaneum. Next, joints taking part, main joints taking part in inversion and eversion are the subtalar joint, that is talocalcaneal joint and talocalcaneonavicular joint. Accessory joint is mid-tarsal joint, also known as transverse tarsal joint. What is the axis of movement? The movement of inversion and eversion takes place around the oblique axis that runs forward and upward and medially, passes from neck of calcaneum through the sinus tarsi to the superomedial aspect of neck of the talus. In the previous picture you have seen the axis. Next, range of movement of inversion is more than eversion. Inversion 30 degree, eversion 20 degree. In plantar flexion, the ankle joint becomes less stable and increases the range of movement of inversion and eversion. And in plantar flexion, the narrow posterior part of trochlear surface of talus occupies the large anterior part of ankle mortis tibiofibular socket, which permits slight side to side movement of the talus. Next, muscles involved, principal muscle, accessory muscle. Principal muscle tibialis anterior and posterior for inversion, accessory is flexor hallucis longus, flexor digitorum longus. And muscle of eversion, principal muscle is peroneus longus, peroneus brevis, accessory muscle is peroneus tertius. Okay, next. Muscle involved are very important and joint involved, subtalar, talocalcaneonavicular, mid-tarsal. Next, limiting factors. The limiting factors limit the range of movement. These are follows. Inversion is limited by tension of peroneus, peroneus longi and brevis and cervical ligament, and eversion is limited by tension of tibialis anterior, tibialis posterior and deltoid ligament. That means opposite muscles and ligaments. Next, functional significance, movement of eversion and inversion help to walk on uneven ground or sloping ground. And when the feet are on the ground, the movement of inversion eversion get modified as supination and pronation of the foot. Next, pronation and supination, these are components of inversion and eversion. In pronation and supination, distal part of foot, that is forefoot, rotates on the talus and calcaneum. And in supination, medial border of forefoot is elevated, whereas in pronation, lateral border of forefoot is elevated. And these movements mainly occur at mid-tarsal and tarsometatarsal joints. Next. So this is difference between inversion and eversion comparison. Inversion, medial border of foot is elevated, eversion, lateral border elevated. Here sole faces medially, sole faces laterally. Associate movement, plantar flexion of foot, adduction of foot. Here dorsiflexion and adduction. Range of movement 30 degree, 20 degree. Principal muscle tibialis anterior posterior, here peroneus longus brevis. Main joint involved is subtalar talocalcaneonavicular, here subtalar talocalcaneonavicular. This is same. Associated with supination of foot, here pronation of foot. Next. Okay, that's all. Any queries? So you read the important ligaments. Okay, ankle joint may come, not very frequently given, but inversion, eversion very frequently given question. Short note or long question. Okay, important ligaments you read: deltoid ligament, spring ligament, and the joint, subtalar joint, mid-tarsal joint. These are important for your viva. Also long question. Okay, understood?